Hi, I'm Dr. Elaine Chin, a long-standing practitioner of personalized medicine for 15 years. People always ask me why I decided to change how I practice primary care. I reply by asking them, why can we predict when a jet engine will fail before the plane crashes, and yet we only treat people after they've literally crashed with a heart attack, stroke, or struck with cancer? We know that approximately 80% of heart disease and up to 90% of type 2 diabetes and 30 to 70% of cancers could be prevented or significantly delayed with lifestyle changes such as a proper diet, adequate exercise, and not smoking or drinking too much. Personalized medicine is about collecting a complete set of information about you to manage your health and well-being more precisely and effectively. It means we know what works, why it works, for whom it works for, and applying that knowledge for all citizens and patients. It's an extraordinary time in healthcare. We are witnessing the democratization of medical information about oneself, generated by oneself. Some of it is now being collected on your own smartphone. With today's technology and the Internet of Medical Things, which many people now call, we can now perform your own checkup in the comfort of your home, along with your smartphone and some wearables and connectables. Information about your vital signs, your skin, eyes, ears, throat, heart, and lungs, and even some routine lab tests can be monitored and sent to your smartphone and then to your health practitioner. In all practicality, you will no longer need to come into a physical office. It will be virtual using video health conferencing, which can be both time-saving and cost-effective. I think the future of the relationship with doctors is going to be very different. I think there's going to be two types of doctors: wellness doctors and sickness doctors. And you're going to have to decide which part of that continuum you're on and why you're wanting to have that conversation. So I am basically, most of the time, a wellness doctor. And that means that people who come to see me want personalized care, and this is what we talk about, personalized medicine, to say, how can my numbers get even better so that I can be performing at peak health? Now, when I'm playing the role of the sickness doctor, people are coming in with, most commonly, a raw throat, coughing, having headaches, or maybe even chest pain, and that flips into a different role as a physician. And so we're in an era now of not just adding physicians to the mix, but also a team of complementary, alternative, allied health professionals. And that continuum of care in the world of personalized medicine will include naturopathic doctors, fitness trainers that are kinesiologists with an understanding of how the body works. We'll use massage therapists, the aid of the mindfulness practitioner and yoga practitioners to give you a holistic model of not just your physical, mental, but also your spiritual well-being. Armed with all the data about you, we can better support how we manage your health and more precisely and effectively work together as a team. Simply put, the data you've collected about yourself will help to predict, prevent, and aid in early detection of diseases. And by understanding your unique physiology, will help to determine the best preventative approaches to managing your health risk or therapeutic methods to treat your disease. No longer should we be practicing population health or trial and error medicine, which we also call one-size-fits-all care, but rather a personalized healthcare model which recognizes one size fits only a few, based on people like me. We are moving from an era from doctors knows best to one which you know best. My role as a personalized medicine physician is to support you in interpreting the data and provide predictive models and therapeutic approaches to keeping you living a long and healthy life free of disability and disease.